Good evening and welcome to Let's Chat with Dr. Celeste MD. I'm your host, Dr. Celeste Reese Willis. I'm a board certified family medicine physician with over 17 years of urgent care experience. I assist busy professionals to find healthcare solutions for their acute and chronic needs via my virtual medicine program as well as my concierge medicine program. Hi, Ms. Bryant. Thanks so much for joining us tonight. So, I thought that I'd hop on tonight, guys. I hope that everyone is out there doing well and safe in quarantine, to have a couple of really more like a dialogue with you about some of the things that have come to light in the last 48 hours, as well as some of the things that we can do as a community to try and help show support during this time of the year. Hi, Dr. Anine. Thanks so much for joining. So first, I wanted to share with you some of the latest numbers for the state of Alabama because that's where I am. And so far in the state of Alabama, as of today, there are 68 cases of the novel coronavirus. There are 31 of those that are reported in Jefferson County, 4 of those in Tuscaloosa, and 2 of those in Montgomery County. I didn't read off all of the 68 county the cases wherein all those 68 cases are, but those are just kind of like the highlights. So you guys may or may not be aware, a couple of hours ago, Dr. Harris, the health state officer, came online, and gave us some restrictions for the entire state. And so I just wanted to review those here. So the newest restrictions in Alabama are that there's no hospital visitation or no nursing home visitation. In addition, they've had cancellation of elective procedures, both medical and dental, no on-premise food consumptions in any restaurants. Now, they are allowing you to still support your local businesses, though, by going through the drive-thru or any kind of delivery mechanism that they may have. They've closed all beaches, praise God, and most preschool and child care centers are closed, except for those that are providing services to first responders, law enforcement, people, assisted living, etc. So I wanted to kind of go over with you guys a little bit about what the latest that we've heard about coronavirus in the last few days, as well as some of the things that we can do. And I also wanted to make sure I was very transparent with you and sharing with you ways that you, or things that you can do to help support the community. So why are we so concerned about the coronavirus? One of the reasons is you're hearing that there are deaths that are occurring as a result of people suffering with this virus. Well, one of the ways that that occurs, or the main mechanism by which that occurs, is the patients developing something that's called ARDS, or acute respiratory distress syndrome. And that is a rapidly progressive disease that typically results in fluid collection in the sacs of your lungs that prevents you from your body or other organs from being able to get oxygen. And we know that all cells in our body need oxygen to be able to live. So most of these patients will present with severe shortness of breath. They're unable to breathe on their own, and oftentimes they may even need ventilator support. And that's one of the things that you may be hearing about in the news, is how some people, a lot of physicians are talking to you about the number of ventilators that we have, and they're talking about that in the state of New York, the number of people that have the virus versus the need, and all those things. The reason why that's important is because people that are suffering from this virus, that ultimately are suffering with death, are developing pneumonia, and they're developing this acute respiratory distress syndrome, which in many cases is often requiring them to have a ventilator. Well, in the hospitals across the United States, we're limited in the number of ventilators that we actually have. And what that means is that we try to decrease the likelihood or need that someone would have for a ventilator. So that's the reason for some of the restrictions that they're putting in place. That's the reasoning behind some of that. I'm going to get into that a little bit further. So let's talk about the way that the virus passes. So we've known for a couple of months now that it can be passed from person to person by a respiratory droplet. So in other words, someone that's infected with it, when they cough or sneeze, if you breathe this in, you can get it from them, correct? So one of the things that has been revealed to us recently is that people can get this by being in close contact within 6 feet of someone else. So that's part of the reason why we're recommending the social distancing. Other things that we've learned: this virus can live on a surface for up to 3 days on some surfaces. So you have to put in your mind it can live on a surface for up to 3 days. In addition to that, recent studies have shown, the most recent studies have shown that it can live in the air for up to 3 hours. So what this means is that you can go into a space where someone has been and you could possibly get it from them. This is another reason for the social distancing. So let's go over one of the things that was shared in the last 48 hours was the thought that patients that are symptomatic or we suspect could have COVID, or people that we know that do, or someone that's been around someone that does, we're telling you, hey, don't use NSAIDs or ibuprofen, Aleve, Motrin, or elderberry. I've told you to take elderberry in the past to help to build up your immune system, so it's likely that some people will be taking out. Some people take elderberry on a regular basis. I know that my sister gives it to her children to help them decrease the risk of them obtaining an infection. So the reason behind that, I'm going to try and break it down just a little bit so that we kind of understand, because I'm a believer that sometimes when people understand why we're asking you to do something, I believe in you being educated and making the right decision that's right for you and for your health. So we're saying no NSAIDs, no elderberry. So there's something that's called cytokine release syndrome that is thought to may exacerbate the symptoms in someone that has COVID-19. So this was a similar inflammatory response that we saw back in 2002, 2003 with the SARS epidemic that some of you may remember. As a matter of fact, COVID actually acts very similar to the SARS virus that was from 2002, 2003. So the way that COVID passes is that it attaches to a protein in your cell that's called an ACE2. That is how COVID binds and passes through your body. That's its entryway point into your body, is attaching to these cells. Well, ibuprofen is known to increase the ACE2 or increase that protein. So this is the theory that they have, or why scientists are saying that ibuprofen or NSAIDs may not be good for someone to use. Now there's a lot of debate about that because there's not proven scientific evidence, but this is what researchers are suggesting. So a lot of physicians have asked. I know that there are a couple of health officials that were on yesterday recommending that patients not use NSAIDs and not use elderberry for this reason. So I'm just kind of breaking down that that's the physiology or science behind it so you can understand why they're telling you that. So ibuprofen basically would boost the production of that protein, and they suspect that that's where COVID is attaching. So that's why they're telling you, hey, make sure that you stay away from ibuprofen and elderberry. So that explains that. Now, one of the things I'd like to do is have a conversation with you about why it is that physicians are coming on social media. I do these Facebook Lives and have been doing them for a while, but you may have noticed an increase in physicians, and you will see that using virtual technology to be able to get to you, to provide you with medical care, to provide you with information. Part of the reason for that, I want to dig into that a little bit. So we have a virus that we see. We've watched it for months over in China and its country and seen how it devastated that community. We know that we need to put restrictions in place because we're trying to protect everyone. You hear a lot of doctors saying, okay, we're going to flatten the curve. That's because it's, the rate of disease diagnosis is going up, up, up. Part of the reason it's going up, so it's starting off on a curve, right? So we're saying to flatten the curve, that we're hoping that the social distancing helps to do this to the curve so that it does not continue to increase in terms of number of patients that are diagnosed with coronavirus. So the purpose of the social distancing is we're trying to flatten the curve. So that's what physicians mean, or scientists mean, when you hear us say that. So what we have is a virus that we know has the potential to be lethal. We know that it has a 14-day incubation period. So that means for 14 days, an individual can go without having symptoms. It is possible during that period of time when they're not having symptoms for them to pass it to another individual. So what this means is that you can be someone that's not having the typical symptoms of coronavirus, fever, cough, and shortness of breath. You can pass it to someone else. This is the reason for the social distancing. Now, you say, okay, so let's just test for it, right? You've heard a lot of reports about the test. Well, if people are asymptomatic, typically when someone is asymptomatic, the same way they are when people have high cholesterol, typically they're asymptomatic. They don't get a lot of symptoms. With high blood pressure, you don't get a lot of symptoms. It's asymptomatic. So what do we do to find out, hey, does this person have high cholesterol? We screen them for it. We do a blood test, right? We do a lipid profile so that we can tell the patients, and usually within 24, 48 hours, we know who has high cholesterol and who does not. We do not have a screening. We have a test for the coronavirus, but we do not have the capacity to screen everyone. Right now, it's looking like a lot less than 10% of individuals in a community, countrywide, nationwide, are actually being screened for this. So you have people that are asymptomatic. So whenever we have an asymptomatic disease like high cholesterol, we will screen them, check their blood. We are not able to screen individuals to find out if they have coronavirus. This means that they can pass it prior to them getting symptoms. So this means we don't know who has it, and we don't know who doesn't have it if they're not having symptoms. So what's happening now because of the decrease in tests, I know inside hospitals, if you're having symptoms of COVID, a lot of times physicians are being forced to treat you like you have it. And that also means that the PPE, or personal protective equipment, is going fast. If you guys will recall, you've seen the pictures in China of physicians, nurses, techs in the huge white lab suits, and they'll have like a hat and a mask and gloves. Well, this protective equipment is what we use to prevent us from getting it so that we're able to still care for you and continue to care for other people. And it prevents us from passing it on. Well, the personal protective equipment is going fast. You've seen a lot of things on social media, if you've been on social media, about physicians talking about this equipment going fast. So, if you have masks, if you have gowns, or any of those materials at your home, and you're not a physician, or you're not a nurse, or you're not a nurse practitioner, please donate it to a local hospital because we need it. Please help us help you. We need it to be able to take care of you. And let me just take a page here. So, I shared with you earlier that I am a family medicine physician, board certified in family medicine. I've practiced urgent care since 2003 for the last 17 years consistently. Over that time period, for the last 17 years, practicing urgent care. Still do some locums work in urgent care because physicians, we want to keep our skills up. And so still am serving in a position to be on the front lines. So a lot of what I'm saying to you, I'm saying on behalf of the other primary care physicians, the other urgent care physicians, on behalf of all the physicians that are serving you at the hospitals and the local emergency rooms, to implore you to please comply with the restrictions that have been placed on you. If you have masks and equipment that is at your home and you are not a healthcare provider, we ask that you would donate to a local hospital because we definitely need it. This situation that we're in right now, I know it seems like it's weird, and a lot of people are like, why do I have to do this? Why do I have to sacrifice my time? Why do I have to give up my vacation? Why do I have to give up my beach trip? This is a new situation for the entire physician community. Even in 2014, when the Ebola virus came out, and there were over 11,000 deaths with that, and even with the SARS in 2002, 2003, over 774 deaths with that. And in 17 years of doing urgent care experience, on average, seeing anywhere from 60, 70, easily 80, 90 patients a day, especially in flu season, very, very familiar with working in that environment. We've not had anything like the pandemic that we're facing right now. You have doctors and nurses and nurse practitioners and medical assistants and lab techs that are treating patients without the proper protective equipment. So that means that they're putting themselves at risk. That means that they're putting their family at risk, their husband or their wife, and their children in an effort to provide medical service for you. So, you have doctors that are being asked to share a mask. Never ever heard of that in the last 17 years in medicine. 2 or 3 doctors asked to share a mask to try and conserve and save because we need it to be able to continue to evaluate and see patients that will come in that are sick or having symptoms or that we have to take care of. There are a lot of primary care physicians. I've talked to several colleagues, been on conference calls with physicians from just all over the country and in different spots and areas. And the same similar theme is that a lot of them cannot even get the protective equipment or the mask to be able to continue to take care of you. So a lot of them are taking a risk and seeing patients without even the proper protective equipment. We have physician groups in our Facebook community, and we have colleagues from overseas in China and Italy that are sharing their stories with us about the things that they went through and trying to kind of give us a heads up, like, hey, we didn't see that this was coming. We're trying to kind of give you a heads up and say, hey, this is what's going on. This is what you need to do. And so they're begging us to not to act in a way that they did not see coming, so that we do not have the devastating effects and the numbers that they did. Now, in addition to that, you have tests. We don't have enough tests to be able to truly, actually screen for an asymptomatic disease. So that is where the social distancing comes in. The single best thing any of us can do, help us to help you, is through the social distancing. And I've had a lot of people ask me, hey, you know what, so does that mean, so I'm quarantined at home? And I'm so glad that they did close the beaches, because it was a horrifying scene for any physician to see that, knowing that there is a lethal viral pathogen that is traipsing across the nation right now, and you have people that are being warned, hey, be socially distant, and are making a selfish decision to go out in that environment and be around other people. And when they get sick, they're going to come to the healthcare system, to physicians who've taken an oath, and we will always do it, because when we put on the white coat and we take that oath to take care of people, that is part of what we do. It's kind of like running into a burning building, so to speak, in terms of what we do as physicians. Now, when we do that, we are putting our lives on the line to try and take care of you. When a nurse does that, she's putting her life on the line to try and take care of you. When that medical tech comes in, when the lab tech comes in, everyone's putting in their lives on the line to take care of you. And so what we need is for you guys to help us. And at this point, we're recommending that people stay at home. And staying at home means staying at home. So that means we shouldn't be doing play dates. We shouldn't be having dinner parties. We shouldn't be trying to visit people in the hospital or in nursing homes. I will share with you that I think that is something that is a selfish decision, because that elderly individual, the lesson that we have is what happened in Washington State in that particular nursing home facility. When you saw that the virus just went through that nursing home facility, several deaths as a result of it being a result of people contracting the virus there. So please respect these guidelines. There are colleagues of mine that have shared this with me and asked me to actually even share it with you. Please respect the guidelines of the hospital and the restrictions that are put in place. They're put in place to try and protect you. We're trying to protect people's lives and their health for two reasons with the no visitors in the hospital and the nursing home. You could be bringing in the COVID-19 virus because you can be asymptomatic for up to 14 days. It can remain airborne up to 3 hours. It can live on surfaces for up to 3 days. You could be bringing it in, or you could take it home with you to your baby or your little toddler or your 10-year-old or your teenager. The ICU at this point has been completely closed to visitors in most hospitals. They had been limiting visitation to one person per patient, one person per patient per day per one of my colleagues. But at this point, I know at least in the state of Alabama, they've restricted it so that you have no visitors. So what I'm asking you to do is please comply with this and what the restrictions that they're giving you, because we're doing it in an effort to try and protect you. We want to make sure we save as many lives as we can and that we decrease the spread of this virus. So one of the things that I did, I was asked by Curtis Cannon, who's with Access Recovery Systems, asked myself, Dr. Cree, Dr. Brandy, as well as Your Kids Urgent Care in Vestavia, seeing the need, because there are a lot of people are in panic and kind of not knowing what to do. So in an effort to try and help for those patients, I know that there were 600 people in line at Church of the Highlands just, was that yesterday or the day before? I think it was yesterday. In an effort trying to get, now that was 2 days ago it started, and then still more in line on yesterday. They were in line trying to get tested, and there were a lot of people that didn't need to be in the line because there's certain guidelines. You have most primary care physicians are offering telehealth services. I definitely am offering those services. I'm actually offering my services at 50% off now. And we'll put a post out later about that. But if you make a telemedicine appointment with me, it's half off, I think $48, to attend to your medical needs as part of this task force that I'm being active with Dr. Cree and Dr. Brandy and with Your Kids Urgent Care. We are doing what we call COVID screenings, where we'll speak with the patient and find out, hey, are you someone that needs to be in the line? Do you really need to be tested or screened for COVID-19? A lot of people are spending hours in line and they don't need to be in line. That's something that can be handled. There are a limited number of tests, so a lot of the tests are being saved from people that are extremely ill and people that we need to know, healthcare workers need to know if a person has the virus or not, so that as they're caring for them, there's a special area that we put people in that we know are contagious and a special way that we treat them utilizing this PPE or personal protective equipment. If we use PPE for people that we don't need it for, then it's being wasted. But the more people that are positive for it, that means the more PPE that we need for every physician that sees that patient, for every nurse that sees that patient, for every lab tech that goes in and sees that patient. So if you think about that, all of that for one patient, then that shows the number of times you're going to need that PPE. So let's decrease the need. There is a lot of pressure and strain on the healthcare system at present. So that's part of the reason for the task force, is to help us kind of say, okay, if there are patients that are in line, you kind of are like, hey, I don't know if I need to be in this line and I'm not. Give us a call, we'll do it, and it's a consult just to find out if you need the testing or you don't. We're board certified physicians able to share that with you whether or not you do, and then putting you in the right place. I know that they definitely have tests at the Your Kids Urgent Care Center in Vestavia, so if there are any kids that are having symptoms, any of that, check with your primary care or your pediatrician, find out if you need to go, and we will get you in touch and in place for that, okay? So that's one thing that we're doing in an effort to, hey, let's try and help mitigate some of the risks. The second thing is me coming on and talking to you guys today. Some of you out there that may be listening, maybe people that have been following, and we've been sharing information with you. And part of what we do here with the team at Dr. Celeste MD is trying to keep you informed and help you make decisions that are the best for you. Part of the talk today has to do with trying to help with the stress that's on the healthcare system at present and some of the frustrations that I'm hearing from colleagues of mine that are emergency medicine physicians, the ER nurses, primary care providers, pediatricians, urgent care physicians, because we still work to try and take some of the burden off of the hospital system to try and help kind of filter and triage who needs to go to the hospital, who does not. If you're not extremely ill at this point, a lot of emergency rooms are recommending that you call your primary care physician first. And if you have symptoms of COVID, please call us first for a consult before you go in, so that we can make sure we arrange things in the right way to help reduce the chance of infection spread and help with infection control. And then lastly, one of the things one of my colleagues wanted me to make sure that I share with you guys is that they are in need of blood donors. Now, we are practicing social distancing, so you may say, hey, so how can I do that, Dr. Celeste? How can I go in and give blood? Well, you can call the Red Cross, look up their website for the Red Cross. You can make an appointment to be a blood donor, because with all the stress all of this has caused on the healthcare system and on hospital systems, they are in need of blood donors. So definitely, if you're a blood donor, please give them a call, and they will set up a way to safely set up an appointment for you to be able to be a donator, because we definitely are in need of blood. So after saying all that, so I'm sharing this with you, and I want to make sure I'm board certified in family medicine, urgent care. Most people that know me, and especially if you're out there and you're a patient of mine, you know that I love what I do. Because God made me to do this and service medicine in this way. But I do feel like it's very important to be transparent and to be honest, and to make sure that you're aware of the times that we're seeing right now. We have not seen anything like this in healthcare, where the hospital system is so stressed that we do not have all of the proper materials and things that we need to be able to take care of you. So help us take care of you. one of the main things that you can do and ways you can support our community, be a blood donor. Don't visit the hospital or nursing home. I can only imagine what you feel like having your mother or your grandmother that's in a nursing home or in a hospital, and you feel like that you cannot visit them, cannot see them. But such as a time as this, that is what we need to do. I implore you, we have colleagues in Italy and in China that are sending us messages daily to say, hey, please tell them, please don't let what happened to us happen to you. And so that's part of the reason of me sharing that with you today. The next thing you can do, no play dates, no dinner parties. Please do not come into the clinic. People are stealing our mask. They're stealing our hand sanitizer. They're stealing our Lysol. And so that's impeding our ability to safely take care of you. So if we get sick and we have to be quarantined, then there are less people that are able to help take care of you, putting more strain and stress on the healthcare system. There is only so much that the healthcare system can stand. Remember, we talked about ARDS, and that being the major complication for the coronavirus, and that oftentimes patients that have that complication need ventilator support. There's only a limited supply of ventilators in every hospital across the entire country. So that is the reason why we need to not get in that predicament by not putting ourselves in situations like going to a beach at this point. And, you know, the thousands of people that were shown at the beaches in Alabama and Florida was a very disturbing picture, especially for those of us, those physicians in the healthcare community that put our lives on the line every day to help take care of you. And we do it proudly because we took an oath to, and we take that oath very seriously. But we need you to help us. So let's be a blood donor. No visitors in the hospital, no play dates, no dinner parties. Please don't steal our mask and our hand sanitizers and Lysol and other things when you come into the clinic. Please practice social distancing, and that's 6 feet. I heard something very disturbing today in terms of someone that felt like we did not necessarily need to practice social distancing, or they were questioning whether or not that was something that needed to be practiced. I implore you, this is a virus that passes before you have symptoms. So that means that we don't know who has it. We are doing screenings. A lot of people are being misguided in, thinking, oh, we only have 68 cases in Alabama. Well, we're not doing as many tests as we would like to do, or would have the capacity to do for the people that we need to do it for to determine it. As we test more people, the numbers will go up. But what is important is for us to practice the social distancing. That means we have an opportunity here for us to coalesce and bond as families a little bit more. And I know that these are times unheard of, but I just implore you to please take all of that into consideration. So if you're out there and you're not sure what to do now, the last thing I wanted to make sure I touched on. So I am offering telemedicine visits at half off. The HHS, or Health System Services, has relaxed the guidelines that will allow physicians to treat across state lines. So that means that we'd be able to offer telemedicine visits in other states, whereas before we might not be able to do that. So I'm more than happy to offer that service to any of you that are listening or that live in the United States that need a telemedicine visit, whether that's refill on most medications, not controlled medications, but most medications. That's an evaluation if you're having allergy. And so that's another thing to keep in mind, guys. We're right here at allergy season. The flu's still ramping up and you have coronavirus. So those things kind of overlap each other, and it can be a very confusing picture sometimes. So if you're out there having symptoms, by all means, please call your physician for a telemedicine visit. If you don't have one or you want to see me for your services or for a consultation, please visit my website. It should be in the chat. It's drcelestemd.com. Again, Dr. Celestemd, DoctorCelestemd.com, and just click telemedicine services. It will give you a block where you can check if you want a COVID screening, or it will give you a block for half off the quarantine special if you have any medical needs that you need serviced and you live in these United States. Now, lastly but not leastly, and thanks so much everyone for joining, tomorrow I'm having my book launched. I wrote a book called Vitality. A lot has been going on with the coronavirus, and that definitely has been an interest point of mine, as many of you know, for the last several months. And so we've been distracted a little bit with that, but I wrote a book, and I'm excited about it, and I'm going to tell you guys about it tomorrow. Tomorrow will be no corona talk at all. just me sharing my heart with you, and this book that I wrote that I'm very excited about, that I hope that some of you are able to get a copy of. I hope that everyone is staying safe. I hope that everyone's drinking at least 2 liters of water a day for women, 3 liters of water a day for men. Please make sure you're getting your exercise in. I will come to you with updates in the next several days to share with you, different things and ideas and things that we can do at home. I know one great thing is my trainer Lewis did. He's doing like a virtual program. A lot of gym owners and trainers are doing that. Online gym courses where you're able to get your exercise in at home. That is important because it helps to build your immunity. So we want to make sure we do that. Okay, thanks so much. Hey, Celeste, thanks for joining. My aunt, Auntie Gina's there. Hey, Delane, thanks so much for joining. Hi, Dr. Mashika. Thanks so much for joining. She's optimizing everyone's offices. Dr. Mashika. Hi, Dr. Katisha. Thanks for joining. Hi, Darnell. Thanks so much for joining. Hi, Gigi. Thanks so much for joining. And hi, Miss Tate. Hi, Miss Young. Thanks so much for joining. So, guys, that's all that I have with you today. I hope that what I shared was helpful and clear, and I hope that everyone takes it seriously. And I hope that we all join together as a community to try and decrease and mitigate the spread of this virus. I encourage you, if you have friends or family that are physicians, please pray for them. Please call and check on them. There's a lot of stress that's being put in the healthcare system at this time, and being on the front lines and be a very challenging environment and situation, but we do it because we took an oath to do it, and there's nothing else that we'd rather do at this time. I definitely know there's nothing else I would rather do than to help service people in medicine and help in a time of a crisis such as this one. So with that, ladies and gentlemen, please pray for your physician friends, as well as your friends that are nurses, nurse practitioners, medical assistant, lab techs, because we are being put in very challenging situations, and we need the prayers, and we all definitely need God's help. So with that, ladies and gentlemen, we're going to say good night. I'll talk to you guys tomorrow for my book launch, and everybody stay safe. Bye-bye.